All right, I'm in chapter 84. We're going to talk about the complications of diabetes. There are two big complications. One is DKA, or diabetic ketoacidosis, and the other is HHS, which is hyperglycemic hyperosmolar state. So DKA is more common with type 1 diabetics as opposed to HHS, which is more common with type 2 diabetics. It's important that you be able to differentiate the two conditions and the differing symptoms. So with DKA, sugar levels will be high. They will be over 300. With HHS, sugar levels are actually over 600, so quite a bit higher. With DKA, the onset is rapid, as opposed to HHS, which the onset is more slow and gradual. With DKA, you're going to have ketones in the blood and urine, and in all likelihood, the presence of metabolic acidosis. However, with HHS, you will not have metabolic acidosis, and so you will have no ketones in the blood and urine. However, you will have profound dehydration with HHS. So let's talk about some of the risk factors. With DKA, one big risk factor is either a undiagnosed or undertreated type 1 diabetic patient. So sometimes the first time a patient finds out that they're diabetic or has type 1 diabetes is when they end up in the hospital with DKA. If they've missed a dose of insulin, this can cause DKA, but infection is actually the number one cause of DKA. So if you have a type 1 diabetic and they are undergoing a period of infection or stress or some other type of illness, this can often lead to DKA. So definitely know that infection is the number one cause of DKA. For HHS, we often see this in older adults who are taking an inadequate fluid intake, so they become dehydrated. These older adults often have decreased kidney function, and then if they have an infection or some kind of stress, this can bring on HHS. So on the next page of my book, which is page 928, it has a table of clinical manifestations. I wouldn't get hung up in knowing, I'd be familiar with it, but I wouldn't memorize the entire table. I would just know that there's quite a few items on this list that relate to metabolic acidosis. So again, we're having metabolic acidosis with DKA only and not with HHS. So some of the things that kind of go hand in hand with metabolic acidosis include GI upset, like nausea, vomiting, abdominal pain, fruity odor of the breath due to the ketones, Kussmaul respiration, so that's like really rapid, really deep respirations, trying to get rid of that CO2. And those are the main ones. So that's what I would know. There's another table here on the next page on 929, which differentiates DKA from HHS, and we've kind of already gone over that. So again, we looked at the differences in sugar levels. We talked about the presence of ketones or lack of ketones, and we basically said with DKA, you have metabolic acidosis and you don't have acidosis with HHS. So in terms of nursing care, you're definitely going to treat the underlying cause, because again, what is the most common cause of DKA? It's infection. So you got to treat the underlying cause and treat that infection. You're going to want to do fluid replacement with like rapid isotonic fluid, 0.9% sodium chloride. You're going to be providing insulin to bring the sugar levels down. But do remember that as you're giving a lot of insulin, that's helping the glucose get into the cells, but it's also moving potassium into the cells. So you have to keep an eye on their potassium levels and monitor the patient for hypokalemia. If they have metabolic acidosis with the DKA, then you may also need to give the patient sodium bicarbonate to help address that. You are likely going to be monitoring their blood glucose every hour or more while you're treating them, and you want to get their blood glucose below 200. So that is the goal. In terms of teaching for the patients on how to avoid this in the future, it's important that they monitor their blood glucose more frequently when they're ill. So every 1 to 4 hours is the recommendation. They should never skip an insulin dose when they're ill. So again, they're monitoring their blood glucose more carefully, and they may need more insulin during times of illness to help bring their levels down to the proper range. They should wear a medical alert bracelet. They should definitely hydrate. So drink at least 3 liters of water per day. When they're unable to drink, unable to eat solid food, like if they're sick, they have some kind of GI distress of some sort, they should consume liquids with carbohydrates and electrolytes such as sport drinks. They should notify their provider if the illness lasts for more than 1 day. If their blood glucose is greater than 240, these are really important points, by the way, and if there are ketones found in the urine for more than 24 hours, or if they have a fever of over 38.6 degrees Celsius. So those are all indications that they should notify their provider right away. So hopefully that's helpful. I'll be back with the next chapter. Thank you.